Good afternoon. I'm going to call to order this meeting of the officially now Public Health, Environment, Civil Rights, and Engagement Committee. My name is Philippe Cunningham, and I am the chair of this committee. With me at the dais are Council Members Cano, Schrader, and Council Vice President Jenkins. Let the record reflect we have a quorum. We should have a couple of other folks hopefully joining us here shortly. Before we begin, I want to note that we will be adding a walk-on item to the agenda today to receive a presentation on the young men of color sexual health work. This item will be heard prior to item 6. First, I'll go through the consent agenda. We have 5 consent items on today's agenda. The first is our contracts, authorizing contracts for 1 year with Clifton Larson Allen, LLP, and Mike Wilson and Associates for Neighborhood Audit Services Panel. This was authorizing 2 different contracts, 1 year, $75,000 through the end of this year to continue audit services and financial management and filing support for contracted neighborhood organizations. The second is, number 2 is 2 Public Health Advisory Committee appointments, approving Brenna Lufek, Seat 1, Ward 1, and Anna Arkin, Seat 8, Ward 8. 3 is a contract with Fairview Health Services for laboratory testing services associated with the city's school-based clinics. Just as a reminder, a couple of meetings ago, we had a very comprehensive presentation on the school-based clinics. I recommend for my colleagues who weren't available to see that. This is for an amount not exceeding $250,000 for lab services for 5 years at the school-based clinics. 4 is the host agency cooperative agreement with MPHA. This is so that MPHA can authorize third-party supportive service providers under contract with the city to enter their properties and deliver services to residents. And number 5 is accrual and use of sick and safe time ordinance. It's passage of ordinance amending Title II, Chapter 4 of the Minneapolis Code of Ordinances relating to administration, workplace regulations, clarifying rules for accrual and use of sick and safe time. Do committee members have any questions? All right, seeing none, I move to approve this consent agenda. All those in favor, please signify by saying aye.
Aye.
Those opposed say no. The ayes have it. So before we get started, today we do have a presentation, a youth violence prevention presentation. But before that, our next item will be receiving and filing a presentation on, let me pull this back up here, the young men's health, young men of color sexual health work, and Nigel will be providing that presentation. Could you please state your name for the record, please?
Thank you, Council Chair Cunningham. My name is Nigel Prout. I'm the Youth Development Coordinator with the Minneapolis Health Department, Adolescent Health and Youth Development Division. And I just want to clarify the walk-on item was a contract for new services, not a presentation. So I don't know.
Fair enough. My apologies for that language.
So just to give some background for people that are not familiar with our Young Men of Color for Sexual Health Services, last year in 2016, we had an RFP process to find a new vendor for doing some work around engaging young men of color and addressing the disparities that create high rates of STIs and STDs specific to chlamydia and gonorrhea. Prior to 2017, we were hoping to get some additional funding from the City Council as part of the 2017 budget, what was cut at the last minute. So within the 2018 budget, we were able to secure an additional $100,000. So we went through a continuation of the last RFP process and went through our top 4 candidates from the last one, and in the end decided to provide an additional contract with Neighborhood Health Source in the amount of $80,000 and $620, and they'll be focusing on providing outreach, linkage to their clinical site for STI testing, and working with youth to develop strategies to address the needs of youth that are impacted by high rates of STI. This would bring us up to 2 vendors currently that we'd be working on with the Young Men of Color sexual health work, and we'll be having a provider not only in South Side right now with Pillsbury Theater, but also adding an additional vendor in the North Side as well. And those generally tend to be the two highest areas within the West Phillips and around the Broadway area where we see the highest rates.
Great,
Right,
thank
any
you so
questions?
much. Are there any questions from the committee members? I just wanted to make sure that we included this in the Peace Committee. I have worked behind the scenes trying to help secure that money for a couple of years now, so I'm really grateful to see this actually be secured and be moving forward. So thank you for that. With that, move to approve? All right. I move to approve this item. All those in favor signify by saying aye.
Aye.
All those opposed say no. That carries. I see I have a question here from my colleague, Councilmember Jenkins.
Thank you.
Thank you, Chair Cunningham. I'm just curious as to, it talks about peer educators, I think. Are those volunteer positions? Are those paid positions? Or is that going to come under the aegis of the contracting agency?
Chair Cunningham, Councilmember Jenkins. For the peer outreach workers, those are based out of the Pillsbury United Communities Pillsbury Theater, and so those are part of the budgeting process, so they actually pay the youth that they're working with. They're not volunteers. And they also work with the youth as well to help develop their skills as well, and providing opportunities for pathways into further public health careers as well.
And then just a follow-up question, are the outreach focus inclusive of queer communities, young men who have sex with men? Do you know if that is a part of their outreach strategy?
Chair Cunningham, Councilmember Jenkins. Yes, we really recognize that men who have sex with men and queer communities are part of those that are disproportionately impacted. And we also recognize too that the language around young men of color can be somewhat problematic because it's not just focusing on male identified, but also trans male identified as well. And so we've been very inclusive of those different populations, understanding not everyone typically falls within the category of male or identifies as male.
And so how will you address that? And I mean, the language is saying young men, and some people may not feel welcome with that language.
Council Chair, Councilmember Jenkins, I'm hoping to work with our new vendors and rebrand this work to be more inclusive. Mm-hmm. Specifically right now with Pillsbury Theater, they have their program is called POSH, which is Positive Outreach Around Sexual Health, which is more inclusive than the young men of color.
Thank you so much.
Thank you, Councilmember Jenkins. I just wanted to say thank you additionally for adding that transmasculine lens. Oftentimes when we're talking about young men of color, transmasculine youth can get left out of that conversation. So thank you to both of you. And seeing no further questions, thank you very much, Mr. Perret.
Thank you.
And now we will be receiving and filing a presentation on youth violence prevention. I'm particularly excited about this work. I'm familiar with it from the work previously that I did in the mayor's office. There's some really, really good work happening. And so now is the time to be able to really get a better understanding of it so that when we look at public safety, we're really looking at it from that comprehensive public health approach. So Sasha Cotton, Youth Violence Coordinator, Health Department, will introduce this item. Ms. Cotton, and will you please say your name for the record?
Thank you, Chair Cunningham. My name is Sasha Cotton, and I'm the Youth Violence Prevention Coordinator for the City of Minneapolis Health Department. So thank you all for having us. We look forward to a robust presentation. We do have a segment for questions at the end, but feel free to chime in if there's a question that's just burning. We're very pleased to have our whole staff here, and they will be jumping in to present. Our work is really full, and everyone's doing touch points on youth violence prevention. So even though violence prevention is in my title, many of my colleagues will be coming up to talk specifically about their work and how it impacts our youth violence prevention work overall. So I'm going to try to move the slides simultaneously. So this is from, we're trying to incorporate pictures because we know that they're interesting and keep folks engaged, and also highlight the young people who are actually a part of the work that we do. So this is from last year's Youth Violence Prevention Week activities, and it was an activity called Hip Hop for Hope, where we did a concert on the north side, but we also had young people march through the streets. We were able to close the streets, really just trying to amplify the issue of youth violence prevention during Youth Violence Prevention Week. So we know with new council members, people may not be familiar with the blueprint, so we wanted to make sure that we went over the history of our work. The Blueprint for Action to Prevent Youth Violence came into its recognition right now in 2008 and was brought about by council action and kind of was brought to the forefront by then Mayor Archie Ryback, but really has lived in community and in the city in a joint capacity. So we're really pleased at the way community has been able to be involved in our work. The Health Department and Adolescent Youth and Health Development has been the lead on the project, but there are various city partners at the table. So when we think about a public health approach to youth violence prevention, it should look at a variety of strategies, and they're listed here, primarily looking at changing cultural norms regarding violence, decreasing access to firearms, affording job and educational opportunities is also a very important part of the way that we do our work, addressing the underlying issues with cyclical relationships with violence, including poverty, health, economic insecurity, trauma, and other outcomes that we know can have negative outcomes for young people, particularly as it pertains to violence, and then leveraging partnerships to develop new programs in response to gaps in existing services. And so that one I think is really important because it speaks to how our work gets funded. And many of the programs that you hear about today are really partnerships between the city's health department and agencies and community who help to deliver those services directly. The public health approach also really looks at a multi-tiered system. What you'll see on the screen right now is the prevention pyramid, and it's something that we use in public health for prevention generally, but as we think about youth violence prevention particularly, primary prevention, which you'll see in green, deals with population-based issues. So it's really trying to help us think broadly about what's good for all young people, things like after-school programming and ensuring that adults have readily opportunities to training that helps them to understand the needs of young people, mentorship. Those are the kinds of programs that you might think about as it pertains to primary prevention. Secondary prevention is really taking it up a notch and thinking about those youth who we know might have indicators for being at risk for being either a victim or a perpetrator of violence. So you might think about intervention-based programs. Some of the programs you'll hear about in our presentation later on. Our Juvenile Supervision Center is one of them, where young people can come and be safe and find opportunities for resources if they've run into trouble with truancy or delinquency at the low level before it's become a chargeable offense. And then the third box or triangle in red is tertiary. And tertiary is really thinking about those young people who either themselves or who live in communities that are chronically plagued by violence, where we know that violence has either been an issue or is very, very likely to have been an issue. How can we make sure that the violence is not perpetuated over and over again and really minimize the effects of the violence? So this is how we think about prevention in the health department. I know sometimes people hear prevention and they think that we're just trying to do things before the problem, but we really have a multi-layer approach in how we think about prevention across the scale. So the Blueprint for Action to Prevent Youth Violence operates with 5 goal areas. They are to foster violent-free social environments for young people, to connect young people to caring adults, to intervene with youth and families at the first sign of risk, to restore youth who have gone down the wrong path, and to protect children and youth from violence in the community. And these 5 goals really help to drive the way we do our work as we build programs and think about partnerships. We really try to look at how anything that we do fits within one of these 5 goal areas. So the 5 primary strategies, when implementing our youth violence prevention efforts are planning and service coordination with jurisdictional and community partners, providing technical assistance to community-based agencies, developing new programs to address identified service gaps, and outreach and community engagement. And the last one is data analysis, and I will apologize up front. Our epidemiologist from our research department was supposed to be here to provide a research update, just a small snapshot of what should be a much more larger conversation with you all. And unfortunately, he is ill today. So I will do my best at the end to talk a little bit about the data that we do have, but I'm just offering a forewarning that I am not a researcher by training, so I want to make sure y'all know that there is someone available to talk more robustly about the data at your request. So planning and service coordination. The picture you see here is actually from a meeting that we had in late 2017. We're in the process of really thinking about how do we make sure that we're being as inclusive as possible with community and service providers and anyone who's really interested in the issue of youth violence prevention, particularly as it pertains to the Blueprint for Action and our executive committee. So this was made up of people who have previously been involved, our current executive committee, and some other planning folks, as well as community members who were interested at large, to really think through some of the strategies we've used, what has worked, but also really to get feedback about what hasn't worked and what we can do better. So that's just a nice picture that highlights some of that work. Planning and service coordination. So one of the key ways that we do our planning and service coordination is through our multi-jurisdictional team. You'll see on the board that we host monthly meetings with a team of multi-jurisdictional partners. And it's an opportunity for a wide range of governmental partners to come together and think strategically about violence prevention as it pertains to youth. And when we say youth, we're really thinking about people under the age of roughly 24. So we use this opportunity for shared learning on the issues of youth violence prevention. For relationship development, we find that it's really important that partners across systems have relationships that they can go back to, so that schools and parks and youth employment don't have to sort of make cold calls to partners in the work, but can pick up the phone and know a name to say, hey, what are you thinking? What are you guys doing? And get that kind of information readily available. Strategic planning related to youth violence prevention. One of the most significant ways that we've looked at strategic planning has been around St. Patrick's Day. In years past, we've had some issues with young people, particularly around safety during St. Patrick's Day. We know that it's a huge celebration, but it's not necessarily defined for young people. There's not really space for them to hold there. But they were still coming downtown and sometimes creating challenges and even violence, potential problems with the police. And so over the years, we've been able to organize using the multi-jurisdictional team with parks and other agencies who are doing strategic outreach to make sure that young people have not only resources downtown during St. Patrick's Day, but also opportunities to do other things that are celebratory. So our partners in parks have taken young people by the busload to water parks or skating rinks on the same night as the St. Patrick's Day parade to offer an alternative way to celebrate that doesn't require them coming down to an adult space. And then evaluation of youth violence prevention programming and process. This is an informal evaluation, but it allows us the opportunity to really think through what we think each of our systems are doing well and where we can be doing better and try to hold each other accountable to how that process could look differently. So these are some of the partners that sit around the multi-jurisdictional team. Health leads this, but the police are present, youth employment and training, neighborhood and community relations, the mayor's office, the city coordinator's office with recast, and then outside of our city, parks are at the table, the public school system, Metro Transit Police, Hennepin County Community Corrections and Rehabilitation, the Youth Coordinating Board, and the U.S. Attorney's Office. And so this table is really open to a wide range of multi-jurisdictional partners. And if any council members would like to come or have their aides attend those meetings, please let us know and we'll be sure to add those names to our mailing list. So what we do at the, I'm going backwards. My apologies. All right. So was I going the right way? I should just push up and down instead of trying to be fancy. Okay. This is where I'm at, right? Okay. So in addition with planning and service coordination, we have a couple of projects that have their own governance structures, one of which is the GVI Executive Committee, which is convened by the mayor, but has a variety of other stakeholders, including the United States Attorney's Office, Hennepin County Attorney's Office, the police chief here in Minneapolis, North Point, and the list kind of goes on and on. I don't want to spend a lot of time just reading those names off the list. Another example of a governance structure that we lead is the Juvenile Supervision Center, which I mentioned earlier. That work group also meets monthly and is chaired by MHG staff, and it provides oversight to the Juvenile Supervision Center. So thinking about technical assistance to our partners, which is another hallmark of our work, this is sort of the logo that we've been using for our Blueprint Approved Institute. It's blue. It's very blue. So the Blueprint is actually a capacity building institute that we designed about 4 years ago. And really the intention with the Blueprint was to provide small local grassroots agencies with an opportunity to partner with the city, but also to really build their skills. What we saw over and over again were individuals, particularly people who had maybe been perpetrators of violence or victims of violence in their youth, who really wanted to give back and do work around youth violence prevention. And they had great ideas, but they didn't have the technical skills. They didn't know how to write a grant. They didn't know how to develop a budget. They weren't clear about board development. And so we started initially with pulling 8 to 10 agencies together as a cohort and doing really in-depth training with them on a variety of those things that we just talked about, as well as more soft skills like mental health and youth, building their capacity to think about GLBTQ youth, thinking about technology and how young people can, have really come into a time where technology is so important if we're going to do youth outreach. Just last year in 2016, we changed our model a little bit, and now we offer a series of public trainings that are open to the public. Anyone who's interested in learning more about youth violence prevention over 10 weeks can participate in those trainings. They're free of cost. And part of the reason we did that was because we felt like as a public health agency and as a city, it's just a good practice if we want to see this industry become robust and provide good services to make sure that people are getting training on these very important issues. After those trainings, we have a requirement of 5 trainings for people who are interested in becoming a part of that cohort, where in the summer we do a deeper dive on technical skills around youth violence prevention, as well as providing a micro grant of $6,000 to those agencies to help them, one, deliver a service, so create some kind of a youth-led youth violence prevention program, but also where they're really networking and meeting each other and building relationships with the city. We know that oftentimes, especially those small agencies, feel really boxed out of being able to access the resources and the technical assistance that the city can provide. And Blueprint Approved Institute has really proven to be a way that small agencies can get into relationship with the city and meet folks who are key players. So another area of technical assistance is coaching boys into men, and I'm going to have my colleague Josh Peterson come to the podium and talk a little bit about this.
Good afternoon, Chair Cunningham and council members. My name is Josh Peterson. I'm the Youth Intervention Coordinator with the Health Department. I'm really just here to give Sasha's voice a break, but since I'm here, I'll talk about some programs. So as Sasha mentioned, one of the other areas where we do some technical assistance is the Coaching Boys into Men project. So we were one of 5 cities selected by the Centers for Disease Control and Prevention to implement a project focused on preventing teen dating violence and youth violence by addressing shared risk and protective factors. And so through that project, we have 2 strategies, one of which is the Coaching Boys into Men work. Coaching Boys into Men is an evidence-based curriculum developed by an organization called Futures Without Violence, which is really meant to instill the values of respect, integrity, and nonviolence with young male athletes who play sports at the high school level. So it leverages the power of the coach-athlete relationship at that high school sports level, and coaches deliver a curriculum with their students throughout the course of a season that really is meant to teach healthy relationship skills and the idea that violence doesn't equal strength. So we are working with Minneapolis Public Schools to help implement that curriculum. So we have a staff, April Graves, who is training their coaches and who's there sort of on site as an advocate to help implement that. And we started that with North High, their football team this past fall, and we're working to expand to Henry and Edison coming up. There's also some interest in expanding throughout Minneapolis Public Schools down the line with that. One note on that sort of dovetails from Nigel's conversation earlier. We recognize that there's some limitations with the Coaching Boys into Men program, specifically that's just directed toward young men. And we are actively working both with our partners at CDC and some of the other sites across the country who are doing Coaching Boys into Men around some ways to make it more inclusive. There is a program that's just being developed for young women who play sports, so we're looking at that. We're also looking at ways to make adaptations to the curriculum to make it more friendly to young people who identify as trans or gender non-binary. So we think the Coaching Boys into Men is a great resource. We're also interested in sort of how we can both improve upon that resource and improve the capacity of our partners that we're working with, specifically the schools and other programs, around how they're engaging those young people.
I want to go ahead and jump in if I may.
Absolutely.
So I wanted to add to this particular program, I feel like at the goal of it, I don't know if I don't know if gender splitting in that way is necessary, because I'm thinking to myself about masculine girls and how, especially like from what I've seen, working at volunteering at Youth Link for as long as I have, that it's typically butch Black girls who experience a lot of homelessness, a lot of violence, often experience similar experiences to Black boys. And so, and identify as such, right? And so I just wanted to kind of name that gray area of masculine versus feminine, because a girl's perspective might not get that masculine perspective, because really what we're talking about is toxic masculinity, right? And so that's not just specifically for boys. And so I just wanted to give that particular feedback, that toxic masculinity really in of itself is what needs to be addressed. And so I'm concerned about those masculine girls that might fall in between the cracks.
Yeah, Chair Cunningham, I appreciate that. And I think that's exactly right. I think that there's a natural sort of gender split with this, because the curriculum is designed to be used with high school sports teams, and they are sort of by nature split by gender. But I think that you're right. There are larger issues at play, like toxic masculinity, which are applicable to both genders, and I think which are identified in sort of both program areas.
Great, thank you. I have a question from Councilmember Jenkins.
Yeah, thank you so much for the presentation. It seems like the project is sort of specifically targeted towards young African American males. I mean, North is one of the pilots, but I mean, we know that lots of young white males are creating violence in our communities as well, and namely in the form of mass shootings in many instances. Is there any efforts to reach some of those young people?
Yeah, Chair Cunningham, Councilmember Jenkins, I appreciate that. I will say that the curriculum itself is not specifically designed for African American young men. The curriculum has been used across the country in cities with all sorts of different demographic makeups. The reason that we're focused on the north side is that for this larger CDC grant, that is the population of focus. So it's not that it's specifically for African American young men so much as that we're specifically focused on the north side. I will also say that the curriculum is really focused on sort of healthy relationship skills. So while it does get at some of the things that might be sort of some of the same risk factors for mass shooters and others, it really is sort of a healthy relationship curriculum, this particular component. I think all of that said, there has been interest on the part of Minneapolis Public Schools to expand this beyond the north side schools. And I think that it is absolutely applicable to those schools as well. And that's something that we're looking at trying to do throughout the duration of this grant, which is a 5-year period. So I'm going to move on and talk a little bit about new program development. This photo you'll see Farji Shahir, who you're going to hear from a little bit later, is one of our violence intervention specialists with our Next Step program. But before we get to that, so one of the roles of public health that Sasha sort of alluded to a little bit earlier is identifying gaps in what services might exist out there, and then really trying to fill those gaps and be sort of a program incubator. So we've seen this in the past a lot around employment programming, for example. The health department has had an active role in developing the North 4 program, which is an employment program for young people who are gang involved, which is now owned sort of in the community by Emerge. The health department was also involved with helping to develop the Build Leaders program, which Chair Cunningham was also involved with the mayor's office and did a great job sort of getting that off the ground. And that now lives with Minneapolis Employment and Training. And that's in part because health has a large role to play in sort of developing these types of programs, but we also recognize that employment really isn't sort of our biggest area of expertise. So when appropriate, it makes sense to sort of hand those programs off to the folks who are better equipped to run them. That said, there are a number of programs that are sort of living with the health department right now, either because they sort of fall within our area of expertise or because they're newer program areas that we're sort of just developing and getting off the ground. So one of those programs is a program called Inspiring Youth. Inspiring Youth is a program for young people who are at risk of involvement with violence. So these are young people who often are exposed to the same risk factors or sort of lack of protective factors as those young people who have already been victimized or who already might be on probation, but they don't have access to services often because they aren't on probation. So really what we saw sort of was this gap of, if you want to get access to a lot of great sort of array of community-based services, you need to be on probation. We said that doesn't make a lot of sense. Why don't we try and address the issue before these young people are caught up in the system? So Inspiring Youth was sort of born out of that as an early intervention program. And it provides sort of a combination of case management and mentorship to young people. Young people are in the program for up to a year, and a youth worker meets with them once a week, really focused on mentorship, case management, accessing basic needs. We are getting referrals for that program from some schools. So Anderson Middle School and Sanford Middle School are making referrals. We're also getting referrals from the Minneapolis Police Department's Juvenile Diversion Program. And briefly, the idea with that is that the Police Department's Juvenile Diversion Program provides a restorative justice intervention for young people who go through it, which is great. Restorative justice is very effective, works very well, but it doesn't always address the myriad needs that these young people are coming in with. So we were able to work with the police department to say, we can offer Inspiring Youth to the young people coming through and address those needs that might be bigger than that restorative justice intervention. So the program launched in 2014. Since then, we've served about 175 young people, and we are funded both from the City General Fund and also from a grant from the State Office of Justice Programs. Another program I'll touch on a little, briefly is a program called Next Step. Next Step is a hospital-based violence intervention program. We are partnered with Hennepin County Medical Center, and we're in the process of partnering with North Memorial Medical Center as well. The idea behind Next Step really is that a gunshot wound or a stab wound is much more than just a physical injury, and young people who are shot or stabbed and treated at the hospital need much more than just to be stitched up and sent on their way. So if you're a young person and you're shot, if you're anybody and you're shot, through the arm, through and through, you may be stitched up and sent on your way from the hospital in a matter of hours. And you've gotten really great medical care, but no one has had a conversation with you around what was happening in your life that may have led to that situation in the first place. And I think more importantly, what additional skills and resources do you now have to go back to that same community in which you were hurt to try and address, the impact of this trauma? So this project was many years in the making. It finally launched in 2016. Since 2016, we've served about 175 participants. As of the 1 year mark, we did sort of a hospital recidivism check. We'd served about 100 young people by that point, and only 3 of those young people had returned to HCMC with the same or similar injury, which to us is a tremendous success. We know that the rate of re-injury for these young people is very high. So to have only 3 young people come back within that year with the same or similar injury is really a great success. A little bit later, you're going to hear from Farji Shahir, our violence intervention specialist. I also want to acknowledge Ann Albrecht, who is one of our primary partners from HCMC. She's their Director of Support Services there. And without her, this partnership wouldn't exist. So thank you, Ann. With that, I'm going to hand it back to Sasha to talk about GBI.
Thank you, Josh, and thanks again for having us. So GBI is an evidence-based model that was created by John Jay College and the National Network for Safe Communities, which is in New York. And they provide a tremendous amount of technical support and technical assistance to us with multiple phone calls every week and site visits on a regular basis. So we're very grateful to have that partnership and to really make sure that we're implementing with fidelity and not just doing something haphazardly. It reduces street group violence involving homicides and gun violence, and I think it's really important to articulate that. Sometimes people think that GBI is a broad-based violence prevention strategy, and it really is about the guns. And so our measures are primarily around the guns, and our outcomes are really about gun offense reductions. We definitely want to see improvement in quality of life as well, so we're looking at both sides of that equation, but it's not thinking about things like robbery or car accidents. There's really a high focus on the guns. A partnership between community members, law enforcement, and social service providers is what this looks at. So GBI is focused on 3 pillars. So it looks at a law enforcement strategy that makes a promise. So the promise that law enforcement make through GBI is that the group violence is no longer tolerable, that law enforcement cares about the community, wants them to be successful, but that includes everyone, and providing safety for everyone is a really important part of what they do, and group violence is a violation of those safety tenets. The community also stands with us. We have a community moral voice group that meets monthly. There's about 12 active members, but it's open to the public across the city. Anyone who's interested in being a part of that, please feel free to share that with your constituency. We meet at Neon on the last Tuesday of every month. And our goal there is really making sure that the community is having a voice, but also holding us accountable with our strategy. That if we're not improving community trust, if we're doing more harm than good, we want the community to give us that feedback. We don't want to do this in isolation. Part of the reason the city really looked at GVI was because it brought that community voice to the table for accountability. So it's important that we keep that robust. We had a 2-day retreat this fall with those members because we wanted to make sure that they had both clear knowledge about what the philosophy is, but also an opportunity to provide information about the strategy and what they want to see on the ground as we move forward with the project. It also engages social services. So we want to make sure that young men, particularly because that's primary demographic, but young people across the board have an opportunity to get real help if they're interested in leaving a lifestyle that involves gangs, groups, and cliques. And so social services become a really critical part of that analysis. Right now, our primary partner is North Point. Engages with a small and active number of people involved in street groups. So we know that it's usually less than 0.5% of any city's population that's driving a significant amount of its gun violence. And that often those are people who have fewer access to resources, fewer ability to leave the network of people that they're connected to and find ways to get positive pro-social outlets. And so we want to be making sure that that's who we're paying attention to, both with a law enforcement lens, but also with a community and help lens, and that we're not making random and arbitrary stops on everyone who meets the description of a suspect, but that we're really focused on the people who are most likely to commit the crime and that are most likely to need the help that we're able to offer. And communicates a credible moral message against violence, prior notice about the consequences of further violence, and a genuine offer of help for those who want it. And so those messages are primarily communicated in one of two ways. One is a call-in, which we've had 2 call-ins this year. A call-in is a meeting where through probation, the community, and the police department, we're able to call in young, thus far all of them have been young men, and offer them a message about the violence. So that message about the violence being intolerable, but also voices from the community about why the violence is intolerable. So we've had Bunny Beeks, whose mother, the case is actually being heard right now for sentencing. And we've had Jamil Jackson, who's the head coach at Patrick Henry, come and talk about how the violence impacts his players, how it impacts his practices, why he knows that the young men who are sitting before him can do better, can be better. He's coached many of them. So it really is a collaboration of law enforcement and the community and also other jurisdictional stakeholders. So our United States attorney speaks there, the county attorney, as well as the chief, to really talk about the impact of the violence. Just for some data snapshots, this year gun recoveries are up by 54.6%, which we certainly won't say GVI has done all of that, but we think it really has made a significant difference in targeting the right people who are most likely to have the guns. That our gang interdiction unit with the police department has the intel that they need, both from their observation, but also insight from the community, that we're getting the right people with the right stops to get the guns off the street, which is a really important tenet of GVI, but also of a broader public health approach. And gunshot victims are down by 18.4%. So we really feel like we're seeing some significant trends in the right direction as we've implemented GVI. To date, since we started the project on May 5th of 2016, we've served 67 clients. We've relocated, I think 5 of them to other jurisdictions because it just wasn't safe for them to be in Minneapolis. But we've also helped a number of them get services that they needed around employment, education. One of the young men that just glimmers in my mind came in and hasn't been able to complete high school, but scored as college ready on his GED test without any preparation. So we've got young brilliance out there that we just need to harvest. And I think GVI has really helped to do some of that work. So commercial and sexual exploitation is actually Nigel Perot's area of expertise, and I'm going to ask him to come back to the podium.
Thank you, Sasha. So just a little bit of context. Previous to my work within the Minneapolis Health Department, I worked for under the state safe harbor law, which is addressing the needs of youth under the age of 18 that have been impacted by commercial sexual exploitation and sex trafficking. And so a lot of the work that I've been doing since I've been starting has really been developing our capacity internally to address the issue, then also working with some community partners on an outreach project that, thank you to Councilmember Cano and being able to secure funds for that. And so we work with the Family Partnerships Pride program in the Minnesota Indian Women's Research Center resource center to do outreach, not just for victims have been impacted by sex trafficking, commercial sex exploitation, but also working with the stakeholders as well within the community and businesses that are also impacted by this. So a lot of their work has been primarily working and identifying strategies and addressing the issues, particularly around the Lake Street area. So they have the encompassing area that they do the outreach in is from Franklin Street to Lake Street, from Park over to 55 Hiawatha. So they've been working with primarily the Powderhorn Park Neighborhood Association and the Southside Safety Coalition, which is convened by the Lake Street Council, and identifying ways that the community and the community-based agencies working with the victims can best serve the victims. For example, one of the things they did with the Powderhorn Parks Neighborhood Association was work with their Crime Watch group to be a little bit more intentional about their Crime Watch outreach, where they tend to be a little bit more aggressive with people that they saw, particularly pimps, and oftentimes that could lead to very significant safety issues, not just for the residents, but also for the women and victims themselves that are on the streets. So they've been able to work with them and kind of develop some better skills in how they do their work. They've also worked with both the community agencies and the community businesses around what are those hot spots within that area, so they can really focus on targeting outreach within the boundaries that I mentioned. And so overall, over this past year, they've been able to reach out to 166 people through outreach, and part of the outreach is also engaging them in service. So the number is a little bit smaller in terms of engagement and services, but 9 out of the 166 have been engaged in long-term services. And they've been able to reach out to 178 community members through the different meetings that they've had with neighborhood associations as well. Additionally, some of the work that we've been doing around commercial sex exploitation and sex trafficking has been motivated by the recent Super Bowl. So as part of capacity building internally, I worked with our health inspection team and the Hennepin Sheriffs and also the Minneapolis Police Department to do training for all our health inspection staff and our jurisdictional partners as part of their work. And overall, we trained 100 staff from both our health inspection team, environmental health, and our jurisdictional partners within the 7-county metro area. We also did training for our regulatory services, including business licensing, animal control, and trafficking control as well, training 97 different individuals. And then as part of back to school, we also trained all our school-based clinic staff in preparation for back to school and the Super Bowl. And finally, I've also been working on developing tools, both to use internally and externally for community members on identifying victims. Particularly with our health inspection staff, they've been able to use these different materials as well as the businesses they're working in, primarily hotels and business restaurants, and the regulatory services as it relates to the recent ordinance that they passed around short-term rental leases. We developed a guide for people that are seeking short-term license as well for short-term rentals to identify potential opportunities or potential commercial exploitation or sex trafficking as they relate to that business. And then also as part of some of the larger Super Bowl planning through the Women's Foundation, we developed a resource list for training specifics to industries impacted potentially by the Super Bowl, so hotels, transportation, restaurants, and medical as well. Okay. And next up, Sasha.
So community engagement is another cornerstone of the way that we do our work. This is a picture from our pop-up parks, which a partnership with Minneapolis Parks and Recreation, and we have Shrina Gibbs here in the audience, who was a key player in helping us develop this strategy. Pop-up parks operate throughout the city and utilize vacant lots and parks that are under-resourced with actual buildings, as well as street fairs, to really create safe places for young people to connect with caring adults and to have space to hold from 4 to 9, 6 days a week. We usually start the week after school lets out in the summer and go until right before school gets ready to start. They're also responsive. So, for example, last year after we had an incident of shooting, the police and other business owners were really struggling with how do we engage the young people who are holding space as a memorial without violating the tenets of good business. You know, they're standing in front of businesses. And so we were able to provide a pop-up park in that space to give those young people an opportunity to grieve the loss that they had, but also be pro-social and connected with services and feed them and just take care of them and love them. So the community engagement strategy of the pop-up parks is just one way that we do that work. So it extends our scope and reach of YC with, oh, this is you, Josh. I was getting ready to talk all about this project, but I think Josh would do a much better job.
You're more than welcome to have it.
No.
Hi again, Chair Cunningham and council members. I'm going to talk briefly about an additional component of our CDC project. So I mentioned earlier the Coaching Boys into Men. This is the other strategy we're working with on that project. So you all may be familiar with the Youth Coordinating Board. They have done outreach downtown and in schools over the past 6 or so years. The funding from the CDC has allowed us to expand that outreach team's work to North Minneapolis, which is really great because it allows an opportunity to engage young people and adults in the neighborhoods, in communities. So through that, a team of outreach workers who are youth work professionals are really sort of building and sustaining safe environments. They're working in the neighborhoods, on the block, in businesses, on transit, in parks. Really the idea is to engage positively with young people, connect young people to resources as needed, provide information about youth-friendly resources. And I think critically another component of it is that the youth work professionals are also engaging with adults in those spaces, trying to help those adults how to better understand how to engage positively with young people, because they're only out there, a handful of hours per week, and those young people are existing in these spaces with adults all the time. So if we can give those adults some skills around how to successfully engage with young people, I think we're going to have much more of a long-term sustainable impact there.
I have a quick question if I can jump in here. I wanted to know where exactly, because when people say North Minneapolis, there's both wards 4 and 5. So just kind of where will the YC, I'm excited to see this, by the way. It's like, yay, this is really needed in the community. So just curious as to where those resources are being targeted right now.
Absolutely, Chair Cunningham, council members, thank you. So at this point, they're really, one of the sort of most valuable things about the outreach team is that there's a lot of flexibility in where they can go. So at this point, they've been in spaces throughout Ward 4 and Ward 5. They tend to focus around spaces where young people are. So they've spent some time around Jerry Gamble's Boys and Girls Club. They spend time in and around schools. They spend time around the West Broadway corridor. They're on Lowry. They're at North Regional Library. They're at Weber Park. They're at Falwell. They're at Farview. So really sort of throughout both wards. And I think one of the nice things about sort of that flexibility and malleability where they can go is that we can be responsive to feedback from partners in community. So for example, Sasha mentioned the sort of ad hoc pop-up park that came up in response to this shooting. We were able to both get the outreach team at that pop-up park, but then also to be sort of focused in that neighborhood in the weeks that followed this so that they can have some targeted attention there. So we have this sort of resource we're able to deploy. I don't mean to sort of speak of it in those inhuman terms, but we have a resource that can be deployed as needed in response to, things that may come up in the community. Absolutely.
I'm going to try to be brief because I want to get us through the end of this so you can hear from our guests. So March 31st through April 8th of this year is where Minneapolis will be recognizing National Youth Violence Prevention Week. And I showed a picture before. National Youth Violence Prevention Week for us is so important because it gives us an opportunity to highlight not only the issue of youth violence, but really the young people who are doing the right things and who are getting the support that they need to really blossom and flourish, and to provide information to agencies and individuals who just need a little bit more of a push to start really doing critical thinking about youth violence prevention. So we do activities and events throughout this entire week. 2 of the hallmarks are a conference for young men and boys of color that we partner with MCTC to do, and that will be on April 5th. And on April 4th, we'll have a symposium for young girls, in partnership with Minneapolis Parks and Rec that will be at North Commons. It's really just an opportunity, again, to celebrate our young people. We also will do a series of other activities throughout that week. We're in the process of curating applications from people and agencies across Minneapolis who want to host a youth violence prevention activity. In the past, we've done one every single day during that week, and we actually just extended the application process through Thursday of this week. So if you have agencies or people in your boards who you think would be really interested in partnering with the city to host an event, it could be a movie screening or a talking circle or a basketball competition or anything under the sun that they can think of, they could tie a youth violence prevention theme to. The city's willing to reimburse up to $1,000 to agencies who want to do an activity like that. So we just think it's a really great time to celebrate our young people and highlight the good work that's happening across Minneapolis. So the data analysis, and this is the tricky part because again, I'm not a research person, but I'm going to try to talk to you guys about these numbers. And if you have questions, I'll try to answer them. So we do data analysis. In the past, every year we had done a results Minneapolis report. The last one that was done was in 2015. That's the last time we were asked to pull one together. And so we continue to collect the data, but haven't put out an actual report, but we're looking forward to doing one in the near future. So looking at the data, this is homicides among youth residents by age and subgroup in Minneapolis over 2008 to 2017. And I think what is important is that we can see that the trends are going down over the last couple of years. One of the things that I want to highlight is that in 2015, we saw a significant spike. And that was really right around the time that our team started to think really critically about what kind of programs we need to have that look specifically at guns. And so that's where we came up with the idea. Really, Next Step had been in the incubator for a while, but what really pushed us to go out on a limb for Next Step and to really start thinking critically about funds for GVI. And so again, not taking credit, but seeing the trend going downward, we think that those programs are helping to make a difference in the issue of youth homicides. So violent crime and victimization, again, these trends are going down a little, but they're still higher than we'd like. So we continue to think about programs and policies that could potentially help to bring those numbers even lower. And again, you can see that the green is our 18 to 24-year-old demographic. So Next Step, GVI, some of our other programs that are newer also have a focus on that age bracket because we know that there's such a high need and that the needs of that community have not always been addressed, or that age demographic have not always been addressed in our core planning. This one is for violent crime involvement with all youth up to ages 24. Again, we're really happy to see those trends going down. We want to just continue to put pressure on the programs that we're utilizing, make them as robust as possible in hopes that we can continue to see those numbers going down. 15 and 16, again, there were spikes. And so with the programs that both launched in 16 and 17, we're really optimistic that hopefully with programs like this, we continue to see a trend going downward. And that brings us to the end of our presentation. I did want to talk just briefly about our Youth Violence Prevention Executive Committee because I know that was a core ask from Council for this presentation. Right now, we're in the process of really looking at how we revitalize that group, that governance structure. In 2017, really that group did not meet. And all of the terms ended in January of 2017. And so we're looking at how we can make that group vital and providing it with real tasks to take on and making sure that people around the table feel like they're being utilized in the best way possible. One of the ways that we're doing that is we've solicited TA from the Department of Justice. We have a relationship through our National Forum on Youth Violence Prevention status with the Department of Justice. And so we've asked them to help us think through what we could be doing around governance and to mirror other structures across the 15 other agencies who are part of the National Forum and what kind of governance structures they're using. The group that I showed you earlier that we pulled together to help us think through our next steps moving forward, both around revitalizing the governance structure and trying to come up with a new blueprint because we know that we're a little out of date and want to revamp and refresh that plan to include all of the work that you've heard about because many of these programs aren't in that booklet, in that particular plan. So those are two pieces of work that we know in 2018 we're going to be looking to tackle and would certainly love any input or insight from the council on those matters. Go ahead. Did you have a question, Councilmember? We also are very pleased to have two of our staff members, one from the Next Step Hospital-Based Intervention Program and the other from the Group Violence Intervention Strategy, just to share some testimonies. So at this time, I'll have Farji Shahir come and talk about Next Step, if that's okay.
I'm sorry, give me one.
Sure.
Did you have a question, Councilmember Gordon?
Well, I had a couple questions,
Yes.
but I just had one on the executive committee issue. So that was created by a city council resolution.
Mm-hmm.
It's probably something that you should get the council direction about to amend the resolution. If we're going to amend the executive committee, it would have been nice maybe if we had some role to play in reshaping it or suspending its activity. I also understand it was very much initiated from the mayor's office back in the day, but let's just make sure that we do that work together.
Thank you, Councilmember Gordon, for that. And just to that point, the appointments ended in 2017, and so they would have been reappointments through the mayor's office, which didn't happen, unfortunately, in last year. And so we're looking forward to what that might look like under this new administration of both council and the mayor. So any insight or thoughts that anyone has, would be very open to working in partnership and taking the leadership from this council.
Well, I'd like to give you a bunch right now, but I'll have to think about it a little bit more. But even a staff direction to help tee that up in the future might be helpful.
Thank you. Okay, Mr. Shahir.
Good afternoon, Chair Cunningham and City Council.
Can you please say your name for the record, please?
My name is Farji Shahir, and I am a violence intervention specialist at Hennepin County's Medical Center with the Next Step program, which has been in operation since about July of 2016. When we first started out, we didn't think we were going to make it this far and see the kind of improvement that we've been seeing. But if you imagine a young man that's in the community and gets shot 13 times, what's going to make him stop, And by initiating these kind of programs into the hospital, we actually found a way to get these young men to actually change their lives around and stop being victims and actually doing things to kind of better themselves and better their lives. We have now about 175 individuals who have been through the program. There are multiple that have not been through the program due to the age demographics and also due to them not wanting to cooperate with the program. We do have about an 85% turnaround. Well, it might be a little bit more than that, but pretty much everybody that we meet who has been a victim of a gunshot wound, stabbing, or a vicious assault has joined Next Step and has taken those next steps in developing a goal plan in their lives and have been violence-free. As Josh was saying, in the last year, out of those 175 people, only 3 of them returned to the hospital with the same or similar wounds. Have you guys ever dealt with someone who's been shot or seen that scene or been inside of a hospital when someone's dealing with that kind of situation? It's pretty traumatic. And it not only affects the individual who's laying in a bed, but it also affects this immediate family and then the immediate community in which that young man is from. As Sasha mentioned, there was a moment of grieving in locations over north where you have these individuals whose lives are taken or who have been shot, and they have friends and family that love them, and they will take to the streets to honor them and to have memorials for them. The one thing that we want to do inside of Next Step is to make sure when they do go outside is that they do not bring other individuals back into the hospital. So by being able to meet those individuals in that hospital bed and then meet their friends and then meet their families, we're kind of able to spread the positive cancer, and it's been working. I see a lot. People ask me how I sleep and how I deal with so much of this violence because I see these individuals when they're bleeding, when they have tubes in them, when they have holes in them, when their chests are cracked open. So it's not easy. It's not easy work, and it takes dedication. Pretty much I've been able to kind of stomach this because this is part of my life. And unfortunately for a lot of these young men and young women who come into the hospital with these gunshot wounds, this is a part of their life. I've been kind of desensitized to it since I've been dealing with it for over 30 years. So I'm able to kind of look at somebody when they're recovering from a gunshot wound and not be emotional, but kind of more or less start developing real-time solutions for the problems at hand. And a lot of these individuals, when they get shot, they have to return to the same neighborhood. So it is our job to not only keep them safe once they leave the hospital, but to ensure that the neighborhood stays safe as well. And that's the effects of the positive cancer when you meet individuals and their friends and then their friends and then their extended friends. And then also just being able to brand Next Step for what it is. Telling these young men when they are in a community, the logo is somebody that has been through the same or similar situation that you've been through. So they've been able to kind of respect each other just based off of the name and off of the logo. Like guys can see each other in the street and don't know each other personally, but if that person's carrying a Next Step bag, it's an initiation for a conversation. And it builds these relationships within our community to where we're kind of able to break down the barriers of these cliques and break down the barriers of these gangs and actually get these individuals to understand that they are valuable and that these young ladies are valuable and that their lives are valuable. And it's impressive to see the turnaround. So I'm just looking forward to continuing the work. It's hard work and we need help. But it takes a special kind of person to be able to stomach as much as we see in the day. So that's all I really have to say.
Thank you so much for your work. It's hearing this and knowing that there are folks out there doing this work is so appreciative, and I'm so grateful to you. Councilmember Gordon, you have a question?
Yeah, I really appreciate you being here and also all that you're doing. I'm curious about if you think there is enough case managers. Do you call yourself a case manager, or you got a title?
We don't have enough staff. We don't have enough staff. If things go well, we will be upping our staff hopefully by June and being able to kind of handle some of this caseloads, because there's 175 people and there's only two case managers, and somehow, some way, we've been able to kind of keep up with a lot of the shootings and stabbings, and I don't know how we do it. I'm losing my hair. I'm not sleeping. I need help. And it's work that needs to be done. It's valuable. I mean, it shows. It shows in the individuals. It shows in the communities in which they come out of. And if we continue to work, hopefully we'll be able to kind of reduce violence and have a summer where no one gets shot.
If I could, do the clients in Next Step, do they graduate or move on? Do you wean them of contact slowly, or the 175, is that the total that you've had, and then you just keep them in a relationship with them, or how does that work?
Pretty much when they start getting their lives back on track, they fall back into their lives, and then the contact reduces. Like we just had a young man who was shot outside a bar, ended up in a wheelchair, and winter came and he needed some assistance in moving. We weren't able to provide him that much assistance. I mean, we helped him get through it, but this man was determined to move to Arizona, and he made that happen. And now that he's in Arizona, I'll probably talk to him maybe once a week, but he's in a different environment. He's got warm weather. He's in a wheelchair, so he's able to get outside and enjoy his life more. And that's just one of them. There's multiple individuals that we have relocated from the Twin Cities area into safer environments where they can thrive.
And I also wanted to ask, and you probably don't know this either, but we talked about how there's only 3 out of the 175 who've come back with similar injuries.
Yes.
Was HCMC tracking that in the past? Can we look back at any group to compare it to that? Or are we just relying on kind of national studies and other?
This is actual data that comes out of HCMC. So we do the numbers, we keep up with the names. There are patient identification numbers for every time a patient is admitted into the hospital, and we cross-reference the names of new patients with the names of the patients who are already in our database.
But part of what I want to be able to do is say there's no doubt in my mind that 3 out of 175 is way better than 2014 when there was, you had one. So I'm just, maybe Josh knows if there is a number that we can use.
Chair Cunningham, Councilmember Gordon. So Farji's right. To get this number, they basically took all the participants in Next Step and by hand ran them through their EPIC database to see if they'd come through. So there is no readily available number at HCMC. Looking back retrospectively, I think that probably could be done with some sort of brute force data effort. I think at the same time, moving forward, as we look to expand the program, we're looking at how we can make our data collection, data capture more robust, both in terms of what our staff are collecting, but also in terms of connecting information from North Memorial, if we expand to North Memorial. So that will allow us to really get a sense of a fuller sense of hospital recidivism, not just coming back to HCMC.
You said if we expand to North Memorial?
I mean, Chair Cunningham, Councilmember Gordon, I say if because there are documents yet to be signed. Council last year was able to get some money for 2018 for expansion to North Memorial. That money has been very helpful in that planning process. We're also in the process of, excuse me, trying to get additional funds from the state who currently funds the program. We're hoping to hear about that very soon. We've had a steering committee put together of North staff since April of 2017 that's been meeting monthly. We've had North staff come with 2 national conferences on this. By all accounts, North is completely on board. They're very interested, but there are business agreements that haven't been signed yet. So.
Okay, thank you.
Councilmember Jenkins.
Yeah, Mr. Shahir, thank you so much for the work that you're doing, and thank you, Chair Cunningham. But it's it's deeply traumatic to be in your role doing that work, and I hope you can find some space to take care of yourself in this process. I was listening to a fascinating but deeply disturbing conversation on NPR yesterday about a very similar project in Chicago. And some of my questions were already asked by Councilmember Gordon, but you know, there's a huge economic impact that takes place for our cities, for our healthcare system as well. And, you know, fortunately, these young people don't die, but unfortunately, they have some significant health challenges, access to, as you mentioned, just going outside of the house, particularly in Minnesota, where we live. But you know, what kinds of strategies have people been thinking about in terms of beyond that initial period of time when you are in contact with these folks, and then the rest of their lives, essentially?
So pretty much what I do within the first, what we do at Next Step within the first 3 months is we try to get them all of the social things that they need, their state IDs, their licenses, things of that nature, so that they become more self-sufficient. So they go to therapy, they go to physical therapy, they go to mental health therapy, and we assist them through this process for the first maybe year. And then after like with the individuals that I still work with from 2016, they've made it through therapy. They've made it to the point where they can suffice on their own, where they're getting their own apartments, where they're getting their driver's licenses, where they're able to take care of their children and keep their children safe as well. So it's like they're learning to value themselves more after the initial contact with Next Step, and then they take that value and they instill it into their lives and they move forward.
So you're connecting people to resources and
Yes,
to
ma'am.
opportunities
Yes.
to try to be
We-
healthier, safer, more productive.
Yes, we get them connected with GEDs, job training. Emerge has been a great help for us. Some of the academy has been a great help for us in allowing these young people to come in and use the space to acquire the skills that they need to move forward in their lives. And then some of the individuals that we meet, they had, you know, regular lifestyles where they were working and they were innocent victims. And sometimes all they need is the mental health therapy and the physical therapy to kind of get them back on the track to where they were at. And then they kind of pick up and take off. Now, the long-term effects of the trauma is yet to be determined. You know, it's hard. You know, you get a young man that gets shot in the head, ain't no telling how long that might take for that person to recover. Thank God that they're alive, they're breathing, they're walking, they're talking. But mentally, I don't know how long it will take for them to heal. We can get them in school. We'll get them in school. We'll get them their IDs. We'll get them the path that they need. But the mental health part is something that needs to be determined. And that information and that research is kind of being hindered right now behind this Dickey Amendment, to where we're not able to kind of do research surrounding gun violence. So maybe if we were to get rid of the Dickey Amendment and allow the CDC to kind of do some of the research, we might be able to have a more powerful impact.
Thank you, Mr. Shahir.
Thank you, Council.
Right, thank you.
Thank you.
Do we have some more guests? Oh, I'm sorry. I have one more question here from Councilmember Kano.
I was just going to talk about you. Are you going to come speak?
Yeah.
Okay, I'll hold my question till after Jerome is done.
So, hi, Council. How you doing? I'm Ferone Brown, and I'm the coordinator for GVI. And so I wanted to bring one of my clients with me, or participants, but I brought Wes. He's the next best thing from North Point. He's my right hand to everything I do. So I told him to just chime in. So I skip around to different things. So if I do and you haven't kind of caught up, just stop me. And a lot of y'all know me up here, so you know how I get down. So basically with GVI, first of all, you know that it's a 3 kind of head. Did all that, so I could just go into it? Okay, cool. All right, so first of all, when I started GVI, I think was in May of last year, the people said I wouldn't get 3 clients out of the call-ins. You guys know about the call-ins and everything. And so I'm at now almost 70 clients of the worst over North Minneapolis, South Minneapolis. And I believe the key is compassion. That's one thing that a lot of our clients or participants really don't get, because you know when you hear gang member, the first thing you're like, I'm walking the other way. I don't want to have anything to do with that. So we work directly with them. And I think the best thing about the work that we do with these guys are resources. The number one key is to help them, guide them to doing better than what they are doing. So the guys we get are either shot or are going to be shot, or, you know, whatever the state quota of they'll be shot or whatever the statistics are. And when we get them, they're at their lowest point to where I have nothing else to live for. Like, what can you do for me? These was exactly what these guys call me and say, well, I need a job. I need this and that. We walk them through the steps, me and Wes and the guys at North Point. If they need a GED, we help them. We do hands-on with them. If they need license, insurance, if they need to help getting their car fixed so they can get back and forth to their job, if they need to get into some type of trade. So we pay for forklift license. I have a guy that we worked with him from the very beginning. I thought he wasn't even going to work with us at the end. He ended up getting his own apartment. He's kept his job the whole time. He's have a baby on the way, and he stayed. And he'll call me like he works 3rd shift. Man, From, I got to get out of this. I was like, don't quit though. Yeah, I said, you just got to make sure that you find another job and then move on. He's like, yeah, I know I can't do it. I got all this stuff going, but it's hands on. It's us making sure that we don't leave them like, okay, they're in the project now, let's move on. We stick with the guys that want to do something, you know, and that's one thing. We're not going to hold your hand, and we're not going to, you know, like, oh, come on, you know, no, this is for you. And when you decide to change your life, this is when the project really works and we make it happen. And so I'd say out of the 70, you can do more of the statistics of the guys that we kind of worked with. So Wes could tell you who he is.
Good afternoon, Council. My name is Wes Berry. As out of the 70 guys that we do work with, I would say we probably have a good 60% of them that have made the switch, that are doing something different with their life now, that are now actually working. Some are actually in school now, and not just for GED, but also for college. We have guys who have now stepped up and actually are partaking in their children's lives, mending broken relationships, not only within their house, but with their extended family as well. One of our guys just recently moved into his own house, got custody of his child, is working, and now is looking to go to college for, I believe it's a bachelor in business. And then he also wants to get into some of the work that we do as well, which is the human service side. So with that being said, it's hard, it's tough, as RJ said before. It is tough work, but the reward is to see these guys do that turnaround, you know. And when they come into office, they no longer have that face of despair. They're not down anymore. They have a little hope, and they're happy. Recently, one of our guys actually, to start the cutting of the ties from his clique, he actually cut his hair.
Mm-hmm.
So, and the young dude looks real good with his haircut. You know, I mean, when he came in, nobody knew who he was. You know, we all kind of just walked past him, not realizing who he was until he smiled. So, it's small stuff like that that kind of rewards the work that we do and being able to see him in a place of happiness, and right now he's actually taking it upon himself to even mentor some of his peers around him and to get them going in the right direction. And has even referred quite a few of them to us.
Wow. Good work, y'all. I mean, it's amazing to have the folks actually on the ground doing the work here. This is the whole reason why having this space to talk about it, so that folks understand, that the council in particular can understand what the investments are that are in the budget every year, what that looks like in terms of humans who are impacted, the amount, how that changes people's lives, how we got good folks doing this work. So thank y'all so much for everything that you do. Like you said, I mean, this is a demographic that folks have thrown away. This is a demographic that folks in general, our mainstream society has said is no longer worth the work. And you are helping the city of Minneapolis actually follow through with saying that your life has worth, and we're going to do what we can to make sure that you see that and that's reflected back at you. So thank you so much for all that you do.
Thank you.
Of course. Did you have more? Oh, yep. I have a question over here. Councilmember Cano.
Thank you. Thank you, Mr. Chair. So, I've been on the council for 4 years plus, this year. And there's been many times where we've been discussing issues up here and I've thought, I should call Ferome. Or I've thought, I wonder what Ferome would have to say about that. And I was lucky enough to meet you and your work probably 15 years ago when Jose Luis was doing work with you, and he was doing tamales and bicicletas, and there was a bunch of community meetings happening around this issue early on. So it's been sort of a model for me to follow and to know that can happen. And as a mother of 3 young boys, and looking at how our Latino community has been impacted by similar issues, I often wish that there was more folks like you doing that work, across other, in other communities as well. So I just want to highlight how important I believe it is to have folks who come from that experience that we're trying to help with or trying to address. How important it is to put those voices at the forefront and to have us as policymakers really follow your lead on that and learn from you and with you as this work develops. And so with that, I want to say a comment more to my colleagues up here in that, sometimes the city council will invest $10,000 here, $20,000 here, $30,000 there. And that's really, kind of a drop in the bucket when it comes to the community work that is both put in because our community members are putting in so much more than that. And then also in the nonprofit world, that kind of dollar amount really is barely able to sustain, one full-time staff year round. So I wonder, as I'm sitting up here, what kind of interface or collaboration we could have between this program and the collaborative safety program that was funded last year by the mayor's office, because that program is also very new, and I don't want us to get into the habit of reinventing the wheel every time that somebody has a good idea, or especially around the campaign year, things take a different tone. So what was exciting to me about that potential program and what we see before us today is the fact that folks who are, coming from that life are leading the change, and that we're allowing for new voices to come into the field to develop those strategies with us, and that we're taking risks in supporting those new strategies because we believe in those communities, like Councilmember Cunningham mentioned earlier. We're kind of flipping the script on that disposability narrative that is coming down to us sort of on the daily now from the federal administration. So with that, I just want to say that, this is making me think a lot about how can we make sure that our programs across the city are more in alignment with each other and leveraging that learning curve, leveraging that information that we know is already proven to be successful and effective, and that we can then replicate and support in other communities to advance a similar agenda in communities that are sometimes facing very similar challenges. So I just wanted to thank you both for all your hard work, and you have my number, and I hope that we can stay in touch throughout the year to see how we can better support what's happening. And I do know a lot about the emotional work that goes into this, and the mental health support that us as community members need to have to be able to do this work every day, and to not lose hope, and to continue to be a positive influence, despite of the fact that even in our own lives we might be facing really heavy challenges, really heavy things to carry. So please know that this is work that will get done with community, and we are community too. Councilmember Philippe Cunningham, myself, Councilmember Jeremiah Ellison, we should be leaned on more as community, not just elected officials. So please reach out to us and know that we're only a Facebook message away or a text message away, just to troubleshoot and figure out how we can really make a difference, because many of us want to see that difference happen.
Thank you so much.
Thank you.
Thank you.
Appreciate it.
Thank you, Councilmember Kano. I would like to just second a couple of points. I would like to really advocate to my colleagues, when we talk about public safety, it's a top issue in many different places in the ward, not just North Minneapolis. When the community comes to us and says, can you please help increase safety, these are the kind of strategies that are actually working to do that. A lot of times, historically, we've seen government systems throwing money into strategies that don't work, strictly just enforcement. But now we're starting to see that prevention and that intervention and that reentry, and really looking at that full picture. And so to my colleagues, again, that $10,000 to $50,000 is really a drop in the bucket when you look at how much money is invested, particularly in enforcement strategies. So really making sure that we are investing equally across the spectrum of public health intervention for public safety. All right. And with that, are there any other questions from my colleagues? Oh, Councilmember Jenkins.
Thank you, Chair Cunningham. I just wanted to express my gratitude for this work and for the work that I know you've been doing for many, many years, and add my name to the list of names that Councilmember Cano asked you to call on, and I'm sure you will, because you've been doing that for many, many years. So please continue to do that and involve me in these issues. And just to the points that have been made about the amount of investment, I really want to continue to emphasize the amount that it costs our society and our city and our healthcare industry in the billions of dollars to care and treat these young people and all people who are dealing with violence. And so when we think about the minuscule investments that we make in these prevention and intervention tactics, it's enormously dwarfed by the amount of resources that we spend on the back end. So I want to make sure we keep that in front of our thought process as well.
Councilmember Johnson.
Thank you, Mr. Chair, and I won't belabor any of these points. I agree with them. I just wanted to personally say thank you for all your great work. It's greatly appreciated by people across the city and sets an example that can hopefully be replicated across the region and nationally as well. And so there's more eyes on you than just in Minneapolis. And again, thank you.
Thank you.
Thank you.
All right. Any other further questions? And Sasha, did you have anything else?
We would just say thank you for your time and for the invitation to present. If you have any other questions, our staff, I believe the names of our staff are at the end of the PowerPoint. We're all in the health department and all help to coordinate the work on the ground. So happy to help liaison any communication with staff that were here or any of the programs that were mentioned. So thank you again for your time.
All right. Thank you, Ms. Cotton.
Thank you.
Did you have a question? Yeah. Oh, Councilmember Gordon.
So This is just to get back, since I had a little more time to contemplate in the staff direction, I do think it is a good idea. So I'd like to give a staff direction asking or directing you to work with your stakeholders, including the council office and the mayor's office, with a recommendation for what to do about the Youth Violence Prevention Executive Committee, and report back to us at a future date. What kind of future date do you think would work if we said 2 months or 4 months, or what's in your work plan so far?
I would think a minimum of 2 months. 4 months would be ideal, just to help us sort of get some time to formulate some things. And we definitely want to, obviously work with this body and other local leaders, but continue to use the TA that's being provided to us at no cost through our partnership with DOJ. So it'd be great to take this staff directive back to our department as well as to them, build some things out that we can bring back to you all.
Well, 4 months is fine, and I appreciate if it's ideal. So that so I'll move that staff direction, maybe as part of the action. Was that clear enough to the clerk and everybody?
You made a motion?
Yes.
Do I need a second?
No.
All right. So all those in favor, please signify by saying aye.
Aye.
All those opposed say no.
You have to receive and file, I think, too.
Mm-hmm. That carries. And seeing no further questions, I move to receive and file this item. All those in favor of the motion, please say aye.
Aye.
Those opposed say no. The ayes have it. That item is received and filed. Before we close, I want to say awesome shirts. Well done,
Thank you.
team.
Anybody want one? We'll get one to y'all.
Size medium. Seeing no further business before this committee, we are adjourned. Thank you very much, everyone.
Thank you.